Hello everyone, welcome to the official podcast by SOA English Cafe in association with SOA Photography Club for the National Conference on Sustainability and Innovation 2026 in collaboration with CAHO. As healthcare continues to advance and reach more people, it also brings new responsibilities. One of the key challenges today is making healthcare systems more sustainable and environmentally responsible. To dive deeper into this topic, we are joined by Professor Ramakrushna Padhy, Professor at IIM Sambalpur. Hello, sir.
Yes.
Before we begin, I would like to take a moment to ask you how you are doing today.
Yeah, fine. It's interesting. Lot of guests. The DGB is a good friend of me. Together we worked in one organization. So I met him after maybe last 5 years. I have not met him. So I met Panigrai as well. And it's a vibrant culture. Students are so active. I'm feeling fine.
That's wonderful to hear. I'm
Yes.
so glad that you are enjoying this experience. Moving on with the questions. Sir, according to you, how important is sustainability and energy conservation in buildings and hospitals?
Look, you started with sustainability in healthcare,
Yes.
and if you look into the various cost component, energy is also one cost component. And if you reduce this cost of energy, that will help both way. One is it will reduce the cost so that at least those who provide the health services, they will get benefit, and that the whole benefit will be passing to the patients. Other thing is also it will be for sustainable to the environment. So if you look into the whole healthcare sector, mostly across world, the healthcare sector buildings is part of the commercial building. It constitutes around something around 9% of the around the commercial building total energy consumption. And in 9%, if you see, most of the healthcare buildings are highly energy intensive. Why highly energy intensive? Because 24 hours things are going on, the ICU, other things. And in most of the cases, if you see, we don't look into how we can save energy. There are a lot of simple things that we can save energy, and there are a lot of studies has been undertaken recently, last 2 years, and I am also monitoring few studies in Orissa as well for few hospital, government departments, buildings, and I found potentially there are huge saving potential is there, particularly for in energy savings. So why we will not do that? That is the first question. That is potential possible.
Yes, sir. I do agree that
Yes.
cost efficiency definitely leverages our work on sustainability.
Yes.
Sir, do you believe what approach, for example, design or policy, will make the energy conservation more powerful?
Yes. Look, both has got the potential to save energy and make the whole sector competitive. First thing is, at present, whatever building we have, if we really wanted to reduce the energy cost, we need a policy support. Mostly, if we can give some of the incentives, that if the buildings can replace many of their old equipment with B rated 5-star equipments, where HVAC equipments are very old fashioned, and if you can think of some of the incentives for reducing their different kind of waste, it can help. And the study shows that, particularly for 2011, the potential of saving is something around more than 20%. And now also the potential of saving is something 6 to 7%, with only policy support, and lot of government institutions and different governments usually give some of the benefits, that is a policy support. Now policy has certain limitations, because there is old buildings, and you can't monitor many things. You can't change the design has been done since long, and there are new buildings are coming up. So how I can design the new building so that it will reduce the energy usage and there are a lot of codes government came up. Orissa government has also has came up with this, and there is a lot of guideline of government of India has came up with that how a building you can make more sustainable. Griha rating is one of them. Griha framework. Lot of frameworks are there across world. Different frameworks people usually follow for doing this. So both are useful. New, when in construction, building code is useful. Existing, various policy measures are required.
Yes, sir, absolutely. That was really insightful. I do agree that we need to redefine our policies as well as design if we want to improve sustainability in the healthcare sector. Moving on with our next question. How do digital technologies help in reducing energy consumption across various industries, including the healthcare sector?
See, in most of the cases, what happens, people don't know what is my baseline. When we talk about you don't know what is happening, like you don't measure, then how you can take action? So measure is very important. So in digital technology, what happens, you have a sensors across, and based on that you can take actions. One such digital technology that is quite popular and starting up now, and many the center of excellences has been made, that is a digital twin. What is digital twin? Digital twin is virtual replica of the reality. For example, in digital twin, you like to replicate the whole building. Then in that you can know how many people are there, what are the energy consumptions, and based on the real-time data, you can take action. And recently I had been to many places because I do also research on digital twin, and we found that the potential saving is 30 to 35%. When some cases is 15%, 15 to 35%. Many corporates they implement. I have seen amazing results. There are many. For example, what happens? The sensors are each in everywhere, and you need to identify what are the optimized sensors you can put it into that. And once that is there, you can monitor each parameter. Not only it will save your energy, it will also enhance the preventive maintenance of the equipment, availability of the equipment, safety, and also you can look into lot of learnings, what I need to do in order to reduce the energy cost. So not only energy cost, it will reduce your the equipment running cost as well. So it is a huge implications. I think the future is digital technology, mostly digital twin. In fact, if you see, whole Singapore government has came up replica of whole Singapore as a town, as a big country. So they know what to do. So digital twin has a huge potential impact, particularly on sustainability as well as on energy conservations. So this is a future, and mostly from your computer science background, I will talk about digital twin and industry 4, and mostly sensors and the data, AI, and all are combined together is having a great future. From the buildings to the equipments to the transport sector to any sector, all energy conservations, it will play a very huge role to play. Fine.
Yes, sir. That was a wonderful remark.
Yes.
Sir, beyond infrastructure and technology, how important is leadership commitment in actually making sustainability initiative work inside a hospital?
Look at whenever we discuss any initiative implementations, any initiatives, whether you talk about quality initiatives, change management initiatives, the leadership has a very, very important role to play everywhere. Unless the leader is interested, you can't do that. And when any initiatives wanted to be implemented, leadership has to monitor it. Leadership has to incentivize it also. For example, somebody is doing it with a great effort, leadership has to recognize that effort. So once the leadership recognize that effort, people will go for it, implementing it. For example, simple behavior. For example, I will tell you, we have I studied, there are around 8 hospitals in Orissa, and I found in one hospital, and in the 8 hospital, we compared what are the energy charges they are paying per kilowatt hour consumption. I will show it in my presentation as well. We found that in one hospital, the leadership is not interested to look from the data itself. It shows the kilowatt hour consumption is one. If you compare 8 hospitals across Orissa, similar kind of things, one is 8 and another is 9 rupees. Yes. And the leadership has not looked into the demand load, which is one of the key component. Many times even the leadership is not interested to look into what are the power factors. The leadership is not looked into what should be the behavior of the people. For example, simply the behavior can reduce many energy consumptions. So leadership plays a very, very vital role, particularly on energy and sustainability aspects, like other initiatives as well, change management initiatives.
Yes, sir. Definitely, leaders and leadership is a very vital role when it comes to sustainability initiatives. For my final question, I'll like to ask you for any piece of advice that you have for young professionals in this healthcare environment or anyone who's watching our videos.
See, for any professionals I'm talking about, we are in a stage where many times we are not in a mood to improve, and there is a Japanese concept called kaizen, that is called change for better. What does it mean? It means that even if there is a small 1% improvement you can do in a whole year, the improvement will be so huge. One has to think of improving little bit every day. That is one. Second thing is also, as a nation and young professionals, we need to think to innovate, because unless otherwise we innovate, we can't compete. In each sector there is a lot of innovations possible. In energy sector also, can you develop some kind of way so that the energy consumption will be less? Can I develop some kind of equipment based on my experience where I am working, so that it will help in better way, improving quality, doing things better, reduces energy consumptions and improve the sustainability. So that is second thing. Is the third point I am talking about is, mostly I have guided many students. There are 5 students are also working under me, 5 PhD students done. I have published around something more papers as well, research papers. What I found in India, particularly I'm talking about the healthcare, is they are not open to sharing data. For example, few days back, I am talking about one of my students was doing a research on cancer care in India, and it took me 1 year to follow up many hospitals to get data itself. So unless we share some data with some privacy policies and do some research, we can't improve. So whether it is in, I'm not talking about data related to human related, even infrastructure related, technology related, unless we experiment, unless the lot of students should not take it as a research, as a theme on some thematic to improve, we can't improve as a healthcare. And Orissa particularly I am talking about has a huge potential to mostly develop as a healthcare service provider, as a place, is a huge potential. Orissa has a very good doctor, very good infrastructure. If you can work on this line, we can develop a good healthcare ecosystems. That is where actually my point is.
Yes, sir, absolutely. I hope our viewers are taking notes, and I'm sure they will find this conversation very insightful. Thank you so much for joining us today and giving us such insightful remarks about sustainability
Thank
and
you. Best
innovation.
wishes to all kind of similar kind of podcasts to with policymakers as well, and so that many people should understand the potence of this kind of initiatives. Fine. Thank you.
Thank you so much, sir. Thank you.